The guidelines that we're going to go over are generated from the Department of Health and Human Services. There's a broad scientific review committee that's put together to review all of the data. The first edition actually came out in 2008, so we're working on the second edition now, which is titled with 2018. However, it was just released in March of 2019, so I wanted to make sure that you had these updated guidelines, and all the data is there. All right, so three main things that we're going to focus on in terms of the major findings. First is looking at some additional health benefits that have been identified with exercise. Some of them are building on what we already knew. Some of them are digging a little deeper into sub-areas within that content topic, and then other ones are new benefits that have been defined since the last guidelines came out. Also, big change on this one is that we're changing from exercise threshold guidelines to volume, so I'll walk through that. And then also some resources here on the local and national level that we can promote to not only patients, but also ourselves if you find that it's difficult to get exercise in. All right, so some new findings, health benefits on this. Sleep probably doesn't surprise you. We have known for years that those that exercise more tend to get better sleep. The latest findings dug a little deeper into that topic, so it has documented now that regular exercisers, or even, as we're going to get to in a couple of slides, with one dose of exercise. Can I have everybody put it on mute?
Last time I did it, I had both of them. I'm going to do both of them.
Can everybody put their phones on mute, please? So with even just one dose of exercise, it reduces the amount of time it takes to fall asleep. It reduces the amount of wakenings that you have during the course of the night. An individual would spend more time in deep sleep and reduces their daytime sleepiness. A big finding that came out with these new guidelines, however, is that when you're exercising doesn't matter. Right, so if you were following the 2008 guidelines, what we typically told patients is not to do moderate, vigorous. Can I have everybody put their phones on mute?
Welcome to WebEx. Enter your access code or meeting number followed by pound. Enter your attendee ID number.
Whoever's dialing in, we can hear.
If you do not know your attendee.
Okay. All right. The newest guidelines say that when you exercise does not have an impact on your sleep that night. So we used to tell folks not to exercise within 3 hours of bedtime. They have done studies now. Significant findings show that whether they are exercising more than 8 hours before bedtime, between 3 and 8 hours before bedtime, or within 3 hours of bedtime, these benefits still exist. So we have removed that barrier, which could prevent a lot of folks, including working professionals, from not engaging in exercise at the end of the day because they were worried about how that would impact their sleep. Also, findings in short-term transient improvements in cognitive function, particularly for children and older adults, even with a single bout of exercise, but this is more dramatic as that exercise became more regular. So you may have heard about the brain gym programs that a lot of schools use before a big test. They get students up, they'll either take them out for recess or they'll just have them move around and do some exercise. We know that that's stimulating that cognitive function, particularly the executive side, which is going to help them focus and organize. We've known for a long time that exercise reduces your risk of developing depression. It's also an effective way to treat depression. The latest findings add to that the impact on depressive symptoms. So before we were looking solely at clinical depression, what this does is look at those that don't have clinical depression, and so those regular day-to-day depressive symptoms that somebody may encounter. Exercise is effective in both reducing those and eliminating them in many cases. Same also with anxiety, very effective in dealing with both chronic and acute. So if you have something that's coming up that has you a little nervous, getting out and getting a little bit of activity in beforehand actually helps calm those nerves. Exercisers also self-rate themselves as higher quality of life. And in older adults, we have known that it is a very effective preventer of falls. The new data builds on that and shows that if they do fall, they are less likely to have an injury as a result of that fall. So that's an important finding too. Immediate benefits, this happens with a single bout of exercise of any duration. Blood pressure goes down, insulin sensitivity improves, sleep that night, it gets better, anxiety goes down like I mentioned, and cognition improves as well. So that is with just a single bout. More regular activity increases the impact of those benefits there and keeps them going for longer. On the ongoing side, we know that exercise is wonderful in being able to reduce the risk of weight gain, reduces overweight and obesity. A lot of research that I'll get into in the last 10 years around the impact of exercise in preventing dementia. Cognitive impairment, we mentioned, falls and fall-related injuries. Big finding on these new guidelines as well. Before, we had heavily focused on breast and colon cancer prevention and management. The new guidelines, there's enough data now to support actually 8 cancers that have a positive impact as a result of exercise. So we've expanded that significantly. And for those that do have existing conditions, we know that exercise decreases the progression of that. And so I'll show you some of the specific ones that they looked at for that. These next couple slides break down those benefits by age group. So I know we don't treat a whole lot of children here, but many of you do have children or grandchildren at home. So I wanted to include some of these slides as well so you could see the whole lifespan. These new guidelines, there was enough data over the last 10 years to actually include preschool children as well. So those in the 3 to 5 group are up on the top. Everything that's bolded is the new information that has come out in these guidelines. The other ones are the information that we had previously in 2008, so that you can see those benefits as well. But the bolded ones do show the newest data. Okay. So getting into adults, we're going to spend a lot of time today on all-cause mortality, but exercise does lower that risk. Lowers the risk of heart disease, stroke, type 2 diabetes. As I mentioned, cancer, we have since expanded that. So instead of just breast and colon, we can now conclusively say that exercise has a positive impact on the prevention of bladder, endometrium, esophageal, kidney, stomach, and lung cancers as well. Reduces the risk of dementia, improves that sleep quality, reduces anxiety and depression. Weight status is better maintained, or prevention of weight gain as a result of exercise. Falls, again, better prevented in those older adults among those that are doing exercise, and particularly less likely to be injured if they do fall. And then the biggest one for older adults that has come out, a lot of research, major meta-analysis going through the impact of exercise on daily activities and physical function, and those that are regular exercisers at any level are more likely to keep that independence that we know our population here so greatly desires. Again, not a huge population within our patient group, but pregnant women or postpartum women, exercise is extremely beneficial during pregnancy and after. Reduces risk of excessive weight gain, gestational diabetes, and postpartum depression. So this is something we want to encourage for that group as well. These next couple slides go into pre-existing conditions. So you're going to notice a lot of the ones that we deal with in the left-hand column there on this slide and the next. The top three there, so the breast, colorectal, and prostate cancer, what this is saying is those patients that already have a diagnosis of breast, colorectal, or prostate cancer, they have a reduced risk of dying from that cancer if they exercise. Okay. With breast and colon, they also have a reduced risk of dying for any reason compared to those that don't. So we do still want to be encouraging exercise. The prostate cancer, they did not have a statistically significant decrease in all-cause mortality, but the prostate cancer death rate did go down among those. Arthritis, decreased pain, improved functions and quality of life. With hypertension, we were seeing a decrease in the progression of high blood pressure, so we can combat that and slow down the continual increase. Also reduce their risk of cardiovascular disease overall. With diabetes, again, I'm going to just go into further detail on this one. I have a neat slide, but reduces their risk of cardiovascular mortality, slows down the progression of the disease. And then looking at multiple sclerosis, dementia, attention deficit hyperactivity disorder, schizophrenia, multiple sclerosis, Parkinson's, and stroke, benefits for those patients as well to start or continue with an exercise program. All right, so key piece here, big takeaways, this section for you. Any activity counts. Before, we had been operating under the assumption that somebody had to do exercise for 10 minutes or more for it to start having a positive benefit, right? In fact, if you have a wearable tracker, exercise tracker, many of those did not start tracking active minutes until you hit the 10-minute threshold, right? And then it would count back, but it wouldn't start until that 10 minutes. The newest guidelines show that activity in as small a burst as 2-minute increments have that benefit, and what we're looking at now is volume over the course of the day instead of those individual time thresholds for each bout of activity. Key piece on this, you'll notice the steepest decline on this chart for all-cause mortality happens when you go from doing absolutely nothing, so our classic couch potatoes, to doing something, right? Now, this something is well outside of our guidelines, which still stand at 150 to 300 minutes a week of moderate intensity. What they found, this steep decline here, from that first bullet to the second, that's 10 minutes a day. So if somebody goes from being a couch potato to getting 10 minutes of activity in each day, their risk of dying for any reason goes down by 20%. So this next slide breaks that out a bit bigger while showing the percentage of adults in the United States that get that level of physical activity. So we have about 32% of American adults that get no physical activity. Okay? So if we can move them down to just 10 minutes a day, that risk in this group for 32% of the population would decrease by 20%, which is a huge public health impact. The other key piece on this, before we were worried about potentially too much exercise, so an upper limit on those thresholds of how much somebody should be exercising. That has been removed, and you can see that there is that positive effect with just a slight increase at the end, but it really just gets you back to our current targets on that increase and the reduction in dying for any reason. So I've mentioned moderate intensity quite a few times already. Wanted to stop at this point and talk about what we use in the wellness and education to define it to participants that come in. So we use what's called the talk test. And what the talk test is, if you can talk while you're doing that activity but not sing, then you're in the moderate intensity range. And we want between 150 and 300 minutes in that range, ideally. Okay? The vigorous intensity level is when you cannot carry on a conversation. So you may be out running and you could say hi, but if somebody stops to have a conversation with you, then you're sucking in air, right? And so you need to get those breaths in. That's at the vigorous intensity level. For there, the target is between 75 and 150 minutes a week. The light intensity level we know also has positive impacts. And so that is if you can sing. So if somebody is out gardening or doing light activity, they're still getting that benefit. It just needs to accumulate a bit more in order to start seeing those big health impacts. Okay. In older adults and those that are overweight or obese, what they have found is actually a combination of these two can be very effective. So they call it high-intensity interval training. This is not necessarily what you're going to find if you pull it up on YouTube or go to a fitness center, right? So that's kind of at the extreme. What we can encourage our patients to do if they're out taking a walk at a moderate pace, maybe for 3 or 4 houses on their street, and then either do a light jog or a brisker walk between that house and the next house, and then go back to their moderate pace. So that, even just those small bursts building up, is going to get more of that interval training in there, which does have a positive impact on those two populations. So this is my prettiest slide in the whole slide deck. This is the results from a huge meta-analysis. There were over 1 million people included in this. And what it shows is the relationship between sedentary time and exercise. Right? So up in this top corner where you have the individual sitting, this is somebody that sits for the vast majority of their day, so their sedentary time is the highest, and they're also lowest on the exercise scale, okay? These individuals here in that red zone have the highest risk of dying for any reason, okay? The opposite side of that spectrum, where you have this happy individual out taking a walk, they're getting the most activity. And honestly, in this analysis, the highest level of activity here that they were getting, so the farthest end of your x-axis, was 80 to 90 minutes a day, which granted is a lot, right? But it's not an overwhelming amount, especially for a lot of our patients. It is to start, but many of them are doing that through the day. So these individuals down in this bottom corner, most amount of exercise, least amount of sedentary time, and they have the lowest risk of dying. Now, if you follow that up, so in the corner that's above the walking individual, these are the individuals that have still the highest amount of sedentary time, right? So think your office workers or folks that are sitting for the vast majority of their day. If they balance that out by also getting high levels of exercise, their risk is still down in that lowest zone, okay? On the other side of that, those that do not sit much over the course of the day but don't get any exercise, they are still in a higher risk category there, right? So that exercise is a key piece that we want to make sure we're stressing. Okay, so we have been talking now for a while, and you have all been sitting for that time. So I need you to all stand up and take a stretch break at this point. And then we're going to go into what to do now with this. So when you have a patient in the office, or when you go home and you're struggling with the motivation to get out and do it yourself, what can we do to bring that around, okay? All right, so from the research, what we know increases physical activity. On an individual level, seeing their peer group do it has a huge impact. And so what we tend to counsel folks on here in our wellness classes is choose your friends wisely, okay? This doesn't mean that you have to give up any friends that aren't exercisers or practicing that healthier lifestyle, but try to spend more time with those that are excited about going out to exercise classes or taking a daily walk or doing something else that has that social activity tied into a physical component. So they are getting more of that. We also know that there is a huge tie-in to their healthcare providers giving them the suggestion to do exercise and them actually doing it, particularly if you follow up on that when they come back for the next visit. So if you tell them, look, I want you to start exercising just a bit more, and then they come in and they tell you that they have, we have providers, and I can't thank you enough for this, that actually hoot and holler and jump up and down when they see these positive results on their lab work or their weight or their exercise going up. And those are the folks that don't stop, right? When they have the hard days and they have been celebrated like that and recognized by you guys, it keeps them going. And I can tell you they come back to our classes and then they encourage the other participants because of the response they got. So this is something that we want to make a big deal over. Technology is also valuable for many individuals. It doesn't have to be that they buy a Fitbit or another wearable device. Your old school pedometers can work very well for some folks too. Phones now track step counts, lots of free apps that they can use. It gives them that nudge when they need it, and that can help keep them going. On the community level, we know that this is a lot of policies and procedures. More importantly, the built environment. We are very, very lucky to be in this community. There are so many options for folks to participate in and the safety to be able to get out and do those things. So some of you may remember this from grad school and med school, the socio-ecological framework model. I won't spend a whole lot on this, but just to remind you that we have that individual down at the core, and there is a huge wraparound in support or barriers, depending on what's going on in the community, what communications they're seeing, the technology that's available to them, and then the environment and policies that are there. Okay, so we can be part of that wraparound to make sure that that positive behavior is being adapted. So in terms of resources then, here, like I mentioned, we are lucky. So we have a number of different things available. For those that don't like to get out and do the programs through the recreation department, although there are over 500 physical activity groups through the recreation department, if you don't get the paper, if you live outside of the villages or just don't just subscribe to it, the Rec News, the insert comes out in the paper every Thursday, also available at every recreation center, and it lists all of the programs that are going on in the next week. The Recreation Center also has a number of locations throughout the community with walking trails. So at their regional rec center locations, they have different parks. We're also blessed with different county and state parks in the area that have well-mapped trails available for people to use. MVP, of course, we partner with, and there's also a number of other fitness centers that are accepting Optum that folks can go to if MVP isn't their style. For those at home, video options like Go for Life or YouTube channel with Walk Away the Pounds are available for free that people can put on. And then through our Learning Center, we also have exercise classes. We have a Go for Life class. We have a Matter of Balance class. We have a Tai Chi class. We also do exercises in our Healthy Weight Loss Boot Camp and talk about building that exercise program in the Exercise and Physical Activity Seminar. So that can also help provide that support for folks that need that extra push. All right, so then the guidelines I've broken down into some frequently asked questions. One of the things that has been controversial for a while going back and forth is, well, if somebody is overweight or obese, are they going to still get those same health benefits from exercise? And it is a strong yes on this. So the benefits are similar to those that do have a healthy weight, big reduction in all-cause mortality, cardiovascular disease, type 2 diabetes. For endometrial cancer prevention, the impact is actually increased if somebody is overweight or obese, so it has a larger impact on that group. And the high-intensity interval training, like I mentioned before, is highly effective in those individuals. Injury. So we get a lot of feedback from our ortho group that we encourage folks to exercise, and that's what keeps them in business down there. We want to reduce the risk of injury in folks that are exercising. One, because if they're not exercisers and they go out and they get hurt, they're not going to want to do it again, and we don't want to create that poor habit that could last the rest of their lives. So go slow and build is what we want to tell them. So they don't have to do a whole lot. We're trying to reduce the weekend warrior syndrome. So we just want them to start with something. When they get comfortable with that, build on it. obviously encourage them to use safety equipment, exercise in safe environments, watch the weather as well. There's just limited evidence on the benefits of warm-up and cool-down. Key piece that I want to stress there is do not stretch on cold muscles. So if you think back to how most of us grew up in gym classes as kids, we stretched to warm up, and that is not the way we want to do it. So new guidelines on that is that you want to make sure you have warm muscles, and then you can stop to actually stretch. So if patients do like their warm-up and cool-down, then that is perfectly fine, but not a huge amount of evidence to show the reduction of injury risk as a result. This is another big one that may shock you, but the research shows that that black box warning that we have put on exercise for so long, where individuals should not start or increase an exercise program without talking to their healthcare provider first, there's actually no evidence to support it. What they have found on an anecdotal level is that many people use that as an excuse not to exercise. So if they say, well, I'll be going in to see my doctor next month, I'll ask them then. They get there, they forget to ask, and they say, well, I'll be back in 3 months. I'm just going to have to wait until that point to ask. So the American Medical Association and the Diabetes Association, the Heart Association, are now stressing a common sense approach. If somebody is able to walk around a grocery store unassisted, if they are able to walk into the doctor's office unassisted, they are perfectly fine with taking a walk around their neighborhood within their ability level. The 10,000 step a day count. You remember this was huge as well. It's been set up as that metric that everybody tries to achieve. There's no data to support it. And so what the guideline is when people start an exercise program, specifically a step tracking program, they should determine what their baseline is, and then we know that there's significant benefit to it if they just increase that by 2,000 steps a day. Right? And so then when that becomes their new baseline and they're comfortable with that, then they can do another increase by 2,000 steps a day, and that's going to have a bigger impact on their health than holding out that huge carrot of 10,000 steps when some folks cannot easily get to that from their starting point. And so we want to build on that, and that actually has been shown to have better impact. All right, so this was the one that I told you about, another big change. Instead of focusing on that exercise threshold level of 10 minutes or more, now it just builds up to how much exercise they're doing over the course of the day. So if they want to do it in small bouts, if you have somebody that absolutely loves watching TV and they can commit to every time a commercial comes on, they'll get up and move around for that 2-minute time frame, fantastic. That will add up over the course of the day and they'll be lowering their risk. Okay? We have run into the issue with so many recordable devices now for TV. You may find, because I've found it, if you say to somebody, well, could you get up and do that brief break during the commercials, and they nod their heads and say absolutely yes, and then they come back next time and you find out that they record their show and they don't have commercials on that show, they haven't lied to you, right, but they're not getting any of those commercial breaks in. And so many folks have had great success with finding prompts within the actual TV show. So if they're watching a medical drama, every time they rush to the OR, they get up and they move around. If they're watching Big Bang Theory, if you've ever seen that, you'll know that one of the main characters, Sheldon, will do a distinctive knock on the door, right? Because everybody's seen Big Bang Theory. Right, and so that can be the prompt where they get up and move around during that time frame, right? So we just want them to move. Volume is more important than threshold. So even if they're just taking a 5-minute walk inside their house, moving around, that will add up over the course of the day. The links then to exercise and cognition, talked about that brief transient spike in cognitive effects and focus that we see with any level of activity. There is strong evidence now showing that those that do regular exercise have a lower risk of developing dementia. Actually, it's a they believe 21% of Alzheimer's cases now are the result of physical inactivity. So another big public health impact that this can have, since we do expect Alzheimer's rates to double by 2050, okay? The impact on the cognition was, the effects were actually stronger in females, and the strongest effect was when they were doing it for 45 to 60 minutes a day. So if you do have patients that are really worried about this and looking for something that they can control, exercise is a key piece that we can recommend. All right, diabetes, going to spend a couple minutes on this. The National Diabetes Prevention Program study actually has shown for the last 20 years the importance of exercise on reducing that risk. The latest data in the scientific review for the physical activity guidelines show that individuals of any weight class can reduce their risk of developing type 2 diabetes by about a third, as long as they're hitting those targets of 150 to 300 minutes per week. And there's two recent studies that have just come out, and so it's not quite strong enough yet to base guidelines on, but they're showing that there's also a significant impact even if individuals are not hitting that 150-minute threshold. So again, as long as people are getting active, any little bit is better than none. And so that's what we want to keep pushing, that there's not a threshold on these. This shows the link between exercise and the reduced incidence of developing diabetes, so again, for diabetes prevention. But these were 4 big meta-analyses that were done, and again, you can see a big impact in reduced risk of developing it with those levels of exercise, with the most significant decreases coming from none to some for exercise levels. This next one shows for those that actually have diabetes, the rate that we can reduce their risk of dying from cardiovascular disease, going from no activity, right, so our baseline, to some activity, so not meeting guidelines but doing some. This is a 32% reduction there at the some level, and then down to a 40% reduction of dying from cardiovascular disease if they're doing that 150 to 300 minutes of activity. All right, so the key guidelines, again, these are broken out by age group. Preschool kids, goal is to just get them up and moving. This is a new area within the guidelines. We want to make sure that they're moving and their adult caregivers are moving with them and encouraging that. School-age children and adolescents, still recommending 1 hour of moderate to vigorous physical activity each day. This does include the time that they spend in recess or PE in school, but many schools are not requiring that, and so be sure that you are asking that question if this is for your children or for patients' children or grandchildren, because it does vary by school district. So 60 minutes a day for those kids. For guidelines, key piece, move more and sit less. All right, so optimally, we're breaking those sitting periods every 30 minutes, if not more often. Guidelines still stand at 150 to 300 minutes of moderate intensity activity each week, or 75 minutes to 150 minutes of vigorous intensity, or a combination of those two. So if they're doing a high intensity interval training, then that can balance out there. Adults should also be doing at least 2 days of muscle strengthening activities as well. So that's a key piece for the adult group as well as the older adults. So older adults follow those same guidelines with 150 to 300 minutes of moderate, 2 days of strength training. Balance training is also recommended for the older adult population as well. For those that have pre-existing conditions or disabilities, the standard guidelines, the 150 to 300 minutes, do still carry over to this group, along with the muscle strengthening activities. We want to make sure that they're working within their ability level, though. So this is not something where we want to push them too far. Build slowly as they go, figure out what's going to work best for their individual situation. with the key metric being that they're not being sedentary, that we do have them up and moving around. Pregnant women and postpartum, for women that were regular exercisers before their pregnancies, there's no indication that they need to modify that, even up to the vigorous level, provided that they do have regular prenatal care to make sure that that's not having a negative impact. But even moderate intensity or light intensity exercises are beneficial for both pregnancy and postpartum. And then some key safety pieces. So again, choosing activities that are appropriate. If somebody is a couch potato and they're really excited because they think Zumba could be a good place for them to start, it's not, all right? So we want to caution them to go slow and build. When they do get ready to try out that Zumba class, I always encourage folks to go in and take a spot in the back of the room by the door. Because if they're up front, all excited, and they find out that they can't do the full 50-minute class, they will keep going even beyond their ability level because they don't want to be noticed. And when they're in the back of the room, they can easily sneak out when they've hit their max. We want to keep building on that physical activity to make sure that we stay in that moderate intensity zone, so doing the talk test for that. Using appropriate equipment, safe environments, making smart choices about temperature, staying hydrated. Those are all key safety aspects. And for somebody that does have a medical condition, using their guidance of their doctor for any limitations that they may have. We also strongly encourage everybody not to do any activity if they have unmanaged symptoms. So if something new comes up or they notice something when they exercise, we do tell them to stop that physical activity and get in to see their doctor to have that checked out. So to wrap that up then, key conclusions on that, some is better than none. So for those individuals that do get overwhelmed by thinking that they have to do 2.5 hours of physical activity each week and they're not doing any, all we want them to do is some. So if they go from 0 to 5 minutes a day, it's a huge improvement. If we can get them to 10 minutes a day, even better. That moderate to vigorous activity level is better than the light, but again, moving people along that spectrum when they're ready is important. Hitting that 150 to 300 minutes target per week is about 75% of the maximal benefit. Right, so if people want to do a little bit more than that, then they can, but we liken it to the sunscreen SPF, right? So 30 is really good, 70 is a tiny bit more, but it's not a huge increase. So even if they're hitting that 70 minutes a week or getting down into that target zone, we're really in great shape. The more we do, the better it is. The more regular it is, the better it is. So even small doses on a regular basis, I would gladly take over a large dose that happens just once every so often. So that's a way that we can encourage it as well. But slow and steady and finding what it is that people enjoy doing so that they will stick with it. Okay. All right. Any thoughts or questions on the new guidelines? Brownwood? Any questions at Pinellas? Colony? Santa Barbara? Mulberry?
We're good, thank you.
All right, Bellevue? Any of our call-ins? All right, maybe I should have said it's a stretch break, but that was not a end break. But thank you all for coming. Our next one is going to be on May 14th. Kathy Sammons is going to give an update on the research around the movement therapy program. So mark your calendars for that, and we will see you then. Have a great day.
Thank you.
Thanks, everybody.
Thank you.